Hello everyone. The topic of today's discussion is on the pH 1.61, that is describe and discuss dietary supplements and nutraceuticals. The learning domain is knowledge and the level is knows how. It is considered to be non-core. However, it is important to know about their use. Now, learning points of this competency are: I first describe what does it mean to be a dietary supplement or nutraceutical, then definitions, food sources, pharmacological actions, potential therapeutic uses, adverse drug reactions and interactions, and what are the benefits and what are the limitations or harms they can occur. Dietary supplement is defined as vitamins, minerals, herbs or other botanicals, amino acids or dietary supplements which are used to supplement the diet by increasing dietary intake or concentrates, metabolites, constituents, extracts or any other combination of these ingredients. Widely available forms of dietary supplements are energy drinks, protein powders, sachets, liquids, tablets, and soft gelatin capsules. With the increasing availability and promotional activities, these agents are widely used in society. Please consider they are neither medicines nor the over-the-counter drugs. Many of the ingredients are non-essential and have doubtful or insignificant nutritional value because adequate evidence from controlled trials is lacking. Production is mostly unregulated or is regulated by food standards and safety rules in India. Now, they are used to provide nutritional value to the diet and to achieve. Whereas nutraceuticals are defined as those nutritional components of the diet or food which have some medicinal value. That means there is either a therapeutic utility or some significant useful pharmacological actions to prevent the occurrence of some disease. These are used to promote health and prevent disease. The term was coined by D. Felix in 1989. In true sense, these are not medicines, but they are the parts of the food material with medicinal value within it. Nutraceuticals attract a large number of people due to the beliefs that they boost immunity and improve health, and everybody wants to be hale and hearty. These are costly and yield high profit margins to manufacturers, and these are manufactured by food industry and also by pharmaceutical companies through their subdivisions as wellness division or nutraceutical divisions. These are available just like over-the-counter drugs or also just like cosmetics or other. Now, number of dietary supplements and nutraceuticals which I like to discuss include either a single ingredient or a multi-ingredient products, and would include prebiotics and probiotics, fish oils containing omega-3 fatty acids, coenzyme Q10, ubiquinone, lycopene and zeaxanthin, glucosamine and chondroitin as sulfates, diacerin, melatonin, and dietary polyphenols containing antioxidants, curcumin, red wine, tea, soya flavonoids, quercetin, beta-carotene, and lastly L-arginine. Now all these can be easily found in the market in various trade names, branded names, or as such. Prebiotics function as a food source of good microorganisms. Starches, inulin and pectin are non-digestible food ingredients that stimulate growth and or activity of friendly bacteria in the gut. Now, starch is obtained from potato, green, bananas, barley, oats, rice, beans, legumes. Inulin is found in asparagus, garlic, onion, and soya. Pectin is plentiful found in apples, apricots, carrots, green beans, peaches, raspberry, and tomato. Prebiotics and probiotics dramatically restore the gut microbiome to normal healthy state. A balance normally exists in the gut among the mucosal epithelium, normal gut flora, and immunity of the local GIT mucosa. Prebiotics are found to be useful for gut disorders caused by diseases or antibiotic overuse. Tried in irritable bowel syndrome as general health promoter and to improve digestion. And for this purpose, both prebiotics and postbiotics are used. Probiotics are defined as live organisms that, when taken in adequate quantities, provide a health benefit to the human. Groups of the microbes which have probiotic value are Lactobacillus group, Bifidobacterium group, and Saccharomyces group. And various subspecies of these organisms are commonly used. In addition, E. coli and Lactococcus lactis, which are two commonly available microbiota in gut, are genetically modified to contain phenylalanine hydroxylase and are significantly reduce phenylalanine levels in phenylketonuria. Lactobacillus is commonly used in household for making curd, yogurt, and cheese. Lactobacilli and Saccharomyces are two commonly used preparations and available in market for the treatment of childhood diarrhea in India. Now, single species of E. coli, subtilis, and Clostridium difficile have been tried in uncommon disorders. For example, Clostridium difficile is tried in autism, whereas others are tried in ulcerative colitis in the form of fecal transplant. Probiotics are useful in functional GIT disorders which cause gas and bloating. Commercially available probiotics are mixtures of beneficial lyophilized bacteria and are usually given in the form of tablet, capsule, or sachet orally. For example, Lactobacillus sporogenes, Saccharomyces boulardii, Bacillus cloacei, they are used commonly in some of the preparations. Whereas more than that, B. longum, B. boulardii, Streptococcus, Bacterium mesentericulus, all are combined in other preparations. Some are combined with vitamins also. So, probiotics and prebiotics are just one group which can be called as nutraceuticals. The other important group is essential polyunsaturated fatty acids, PUFA. Fish oils which contain omega-3 fatty acids, particularly cold fish such as salmon, herring, halibut, mackerel, tuna. They have omega-3 fatty acids in the form of alpha-linolenic acid, icosapentaenoic acid EPA, and docosahexaenoic acids. In addition to these, other PUFA omega-6 series are linolenic acid and GLA. Now these two compounds are also useful. Essential fatty acids are not found normally in body and must be supplied from external sources. Therefore, in body, ALA which is obtained from flaxseed, soybeans, canola oil, and walnut is converted into other essential fatty. How do they act? Essential fatty acids, PUFA, they act by two main mechanisms. One is they are converted by a cyclooxygenase and lipooxygenase pathway into the less potent inflammatory mediators, and unlike products of arachidonic acid pathways, they are not causing inflammatory changes, but they have less effect. Some of the mechanism is also contributed by formation of resolvins and protectants which have anti-inflammatory activity. So less formation of inflammatory mediators and anti-inflammatory activity are the reasons. Second is they are also transported across the membranes to nucleus where they will influence the transcription factor by the PAPAR alpha receptor. So ultimately there will be a change in the inflammation and beneficial effect is there. Benefits of the fish oils are accrued by their action on the in the form of lipid reduction, antiplatelet actions, and alteration in leukocyte function. So far as lipid reduction is concerned, they reduce LDL cholesterol, lipoprotein A, and triglycerides, and there are some reports which say increase in the HDL. Now, these, as I told you, they act like fibrates in reducing triglycerides level, acting on the PAPAR alpha receptor. Antiplatelet action is shown because they produce more PGI3, which is a potent platelet inhibitor, than PGI2, and more thromboxane A3, which is less potent than thromboxane A2. So they have antiplatelet action. Fish oils also alter function. Their beneficial effects are shown in some studies in heart failure with reduced ejection fraction, and they have shown that modest improvement can be achieved with their use. They are used in enteral nutrition in the form of 10% fish oils containing formula as emulsions. And the next use is in the cardiovascular risk reduction. For the secondary prevention of the ischemic heart events and preventing sudden cardiac deaths in those who have prevalent risk for coronary heart disease. The AHA does not recommend use of omega-3 fatty acids for primary prevention of the cardiovascular diseases in high-risk patients or for primary prevention of stroke. It is only for secondary prevention and not for primary. The fish oil has also been found to be useful in rheumatoid arthritis to reduce pain, joint pain and stiffness and reduce the daily requirement of anti-inflammatory analgesics. The gamma linolenic acid, which is omega-6 fatty acid, is found in some of the plant oils, primrose, borage and blackcurrant. And the oils of these plants have been shown to be beneficial in relieving rheumatoid arthritis symptoms. Now, there are many other conditions in which PUFA fish oils have been used with no enough evidence of their proven efficacy. Osteoarthritis, glaucoma, prevention of Alzheimer's disease, attention deficiency disorder, cancer risk reduction, diabetes, asthma. In general, the DHA improves the eye health and therefore has been used to prevent macular degeneration. DHA is needed for the development of infants, but exact role is not. One of the derivative of PUFA is icosapent-ethyl. Now it is a concentrated EPA and in high doses of 2 grams twice daily is found beneficial in reducing triglycerides when the levels are excessive, that is in excess of 500 milligram or more. And it has been found in a recent multicentric large-scale trial, Reduce It trial 2022, to reduce the cardiovascular risk by 20 to 26%. Available preparation in India are many. Few representative are 180 milligram EPA with 120 milligram DHA or 500 milligram omega-3 fatty acid as such, and it has been used along with other medicines as add-on. Coenzyme Q10, also called as ubiquinone, is another antioxidant and nutraceutical which is found naturally endogenously in mitochondria of the cells of the organs such as heart, kidney, liver and skeletal muscle. The dietary sources of CoQ10 are meat, fish, seafood and vegetable oils, and the main function is mitochondrial generation of energy ATP, and it has potent antioxidant activity and thus plays role in maintaining muscle and nerve function. The active form of the ubiquinone in blood is ubiquinol, which is an alcohol. It provides neuroprotection by preventing oxidant damage of the DNA and key enzyme proteins in brain. In Parkinsonism, the levels of the Q10 or ubiquinone are found to be reduced. Currently, it is used as purified supplement, or it is used in the treatment or prevention of hypertension. It has been found to reduce systolic and diastolic pressure by 11 millimeter and 7 millimeter mercury respectively because of its antioxidant and vasodilatory action. In heart failure, it has been used because it is found to increase ejection fraction and improve the contractile power of the heart muscle. In ischemic heart disease, it protects the ischemic myocardium by several mechanisms by reducing inflammation and improving the flow so that exercise tolerance is increased and there is prevention of sudden death with absolute risk reduction of 1.5%, and there is also effect on the reduction in the bad lipids, lipoprotein A, and also increase in the HDL lipoprotein. Prevention of statin myopathy is another indication of the use of CoQ10, and it has been found that when used along with statin, the muscle damage is prevented by antioxidant. Doses are usually in excess of 30 mg per day, alone or along with other agents, and for cardiac effects, typical doses are 100 mg to 600 mg per day in divided doses. Single ingredient or multi-ingredient products are available which contain coenzyme Q10 along with PUFA or coenzyme Q10 along with L-arginine or L-carnitine. As such, it is safe, but CoQ10 in excess doses may cause GIT symptoms, anorexia, uncommonly maculopapular rash, and thrombocytopenic purpura. Rarely dizziness and headache can be there. Very important to understand because of structural resemblance of CoQ10 with vitamin K, it interferes with the effect of warfarin, which prevents activation of vitamin. One of the product is shown here, which contains CoQ10 along with levocarnitine and is promoted for the treatment of muscle disorder. L-arginine is yet another product which is actually donor for release of nitric oxide in the endothelium. It is a precursor. L-arginine is an amino acid found in meat, fish, pumpkin seeds, soybean, lentil, peanuts, walnuts, and chicken. It is the source for nitric oxide generation, and it has been found in uncommon disorders also, such as myopathy with lactic acidosis called as MELAS syndrome, necrotizing enterocolitis in children, and also found some usefulness in peripheral vascular disease. Currently, it is commonly used for the treatment of erectile dysfunction, oligohydramnios, and may also reduce preeclampsia risk in pregnant females. ADRs of this are nausea, abdominal pain, diarrhea, bloating, and sometimes allergy. It is commonly used in a dose range of 5 grams to 30 grams as available as sachet. However, because it has a vasodilatory response, so it may interact adversely with sildenafil and oral anticoagulants. A notable point is an anticoagulant direct thrombin inhibitor, argatroban, is a derivative of arginine, and therefore when it is used along with the anticoagulants, it may also adversely affect the PT-INR or other test of bleeding. Glucosamine is produced from circulating monosaccharides and then it is aminated by aminotransferase to form glucosamine 1-phosphate, and it is used by the body to produce glucosaminoglycans and other proteoglycans which are essentially needed for the articular cartilage to provide nutrition, elasticity, strength and flexibility. It is involved in the formation of type 2 collagen in chondrocytes, and also it reduces collagen destruction. So overall it is chondroprotective and it prevents the cartilage destruction in osteoarthritis. Finally, the agent is N-acylated to N-acetylglucosamine, which is needed for the formation of chondroitin sulfate, which is another chondroprotective agent which I shall be discussing. It is commercially derived from crabs and crustaceans, and when given orally, only partly absorbed. It's only 40% bioavailable, and it is found that it has no direct pain relieving activity, but it improves the cartilage, so it reduces the signs of inflammation and joint destruction, including pain, when taken for longer period of times, 1 to 2 months. Some studies show improvement overall mobility, range of the motion and strength in patients with knee and hip joint arthritis. Overall, alone it is used in the dose of 500 mg 3 times daily or 1.5 grams. In osteoarthritis, it reduces the rate of cartilage destruction and also increases rate of formation of cartilage. So, research suggests that use of crystalline formulation of glucosamine leads to less pain, more functional improvement in osteoarthritis, and less reduction in joint space narrowing when used for over a year. And this is the reason why it is extremely commonly used in the treatment of ongoing osteoarthrosis or osteoarthritis. Often it is combined with chondroitin sulfate as a fixed dose formula. It is given orally but has been tried intra-articularly also. As such, it is well tolerated. Mild diarrhea, abdominal cramp, nausea can occur. Again, it can also interfere with warfarin. Chondroitin sulfate is a sulfated glycosaminoglycan GAG having n number of alternating sugars with protein, which is a proteoglycan. Therefore, it is again a component of the articular cartilage. It maintains flexibility and provides nutrition. Commercial chondroitin is obtained from animal cartilage. Now, combination of glucosamine and chondroitin, as I stated earlier, are commonly available and used, and mostly they contain 500 to 750 milligram glucosamine and 400 to 600 chondroitin. Sometimes there is additional pain reliever diacerin along with these ingredients, and some multi-ingredient formulations contain vitamin D, calcium, along with glucosamine, chondroitin and methyl sulfonyl methane as chondroprotective agents. Now we know that heparin is one endogenous substance, anticoagulant, which contains n number of glucosamine, just like chondroitin. Diacerin is an anthraquinone purgative derivative, and it has some pain relieving activity but is not NSAID. It acts mainly as chondroprotective in osteoarthritis, and actually also it reduces cartilage destruction by inhibiting synthesis of interleukin 1 beta that is involved in cartilage breakdown. It prevents oxidant damage and reduces neutrophilic chemotaxis and phagocytosis, so cartilage destruction is retarded. In addition, it is found to promote cartilage growth by production of TGF beta, tumor growth factor beta, which stimulates the chondrocyte proliferation. It is actually a very slow acting drug and must be given for very long time to achieve the pain relief. It has been found to retard the hip joint space narrowing in a dose of 50 milligram once or twice daily. It has been used along with glucosamine and chondroitin with other agents, commonly for the treatment of osteoarthritis, knee and hip joint or other joints. Major adverse effects are not serious. Diarrhea, skin rash may occur. Now, as we know that anthraquinone purgative, which has been discussed many times, is sinusides, that is sinuside A and B. So, diacerin is related to sinuside, so it causes diarrhea. Now, the another important group is flavones, antioxidants, polyphenols from the diet. Now, polyphenols are found in fruits, vegetables, cereals, and common beverages. They are shown to have antioxidant activity, anti-inflammatory, anti-carcinogenic, anti-atherogenic activities. So they are found to be cardioprotective and protective in neurodegenerative disorders. They have been used for cancer prevention and diabetes care. Their value is overall uncertain, but whatever their value is because of antioxidant activity, but they add to the cost of the therapy. And curcumin is a turmeric powder commonly used household as local application during injury as anti-inflammatory, but has been found to have carcinogenic and antioxidant activities. Curcumin is a polyphenol which is obtained from turmeric powder. It suppresses pro-inflammatory cytokines, TNF-alpha and PGE2, and also quenches free radicals, so have antioxidant activity. Additionally, it inhibits lipid peroxidase. Tea, common tea, green tea, black tea, they all have antioxidant compounds including volatile oils, vitamin C, amino acids and minerals, particularly aluminum and magnesium. But green tea is rich in polyphenolic catechin and flavonoids, and therefore it is found to be having a strong antioxidant activities. In addition, it has anti-inflammatory, antiviral, antibacterial, anti-aging, CVS protective, chemoprotective, dermoprotective, and anti-stress activities. And green tea extracts are extremely commonly used in cosmetic dermatology for various disorders and to prevent and keep the skin beautiful. Epidemiological evidence supports the consumption of green tea for lowering the risk of cardiovascular disorders and risk of development of the cirrhosis in non-alcoholic fatty liver disease. This is an important. Red wine traditionally obtained from dark colored grapes and the skin contains resveratrol and other proanthocyanidins which provides potent antioxidant activity to red wine. Red wine is considered to be cardioprotective because of several attributes, because it reduces synthesis of endothelin 1 which contributes to atherogenesis, causes lipid reduction, may reduce risk of cancer and improve cognitive function and may help control of diabetes mellitus. Many compounds are available which contain resveratrol alone as a drug, 500 milligram, has been also found along with quercetin, which is another antioxidant nutraceutical. Is a subtype of bioflavonoid found in broccoli, onion, berries, grapes, apple and tea. Its powerful activities include antioxidant, anti-inflammatory, antibacterial, antiviral, and therefore it is used for cardiovascular, CNS protection and prevention of cancer. Efficacy is beta carotene is obtained from the carrots, is a precursor for vitamin K and is needed to maintain health of eye, skin, immune system. It is antioxidant which prevents the oxidation of LDL cholesterol. Lipid peroxidation is reduced, which play a role in atherogenesis. It has been tried in age-related macular degeneration, photoallergic reactions, scleroderma, and leukopplakia. Usual dose of beta carotene is 16 to 50 milligram for adults, which equals 10 to 25,000 of vitamin A activity. Lesser doses are used in children. It has been found useful in the prevention of the photodermal reaction in erythropoietic protoporphyria. Continuous use may cause skin discoloration, carotenemia, which is yellow. Therefore, yellow discoloration must be distinguished from jaundice. May also cause loose stools, bruising, and joint pain. Lycopenes are the antioxidants obtained from tomato, guava, papaya, watermelon, and sweet red peppers. They accrue pink color because of our presence of these antioxidants lycopene. Lycopene is available as nutraceutical or medicine, tablet, capsule, alone or multi-ingredient antioxidant formulations. It is shown to have good effects on bone mineralization, protection against cancer, and anti-atherosclerotic effect. Exact role is not known. Combination of lycopene with lutein zeanthol or zeanthin is found to be useful in the macular degeneration and eye. Soya flavonoids, they are rich sources of proteins and isoflavonoids, and isoflavonoids in body are changed into genistein and diazine, which are phytoestrogens. They act as selective estrogen receptor modulators. They bind with selectively on estrogen receptor beta and not on the estrogen receptor alpha. In premenopausal women with normal estrogen level, isoflavonoids have anti-estrogenic effect, whereas in postmenopausal with low estrogen levels, there is a weak estrogen effect. Therefore, they have good estrogenic effect overall in females. They also increase excretion of biles and lower cholesterol. They reduce the risk of carcinoma breast, cardiovascular disease, and risk of osteoporosis in Asian women, and this is partly due to their high intake of soya diet. It also protects against carcinoma prostate in males. Ipriflavone is a semi-synthetic isoflavone which is found to be effective in the treatment and prevention of osteoporosis. So about 20 to 60 gram of soya would contain 2.25 milligram per gram and is needed for the treatment of menopausal syndrome. Medicine is also available in the form of several names which contains essential nutrients and antioxidant isoflavones 100 milligrams. Melatonin, as we all know, is a hormone or hormone-like substance formed from serotonin by pineal gland and is mainly responsible for regulating sleep-wake cycle and circadian rhythms. It is produced and released by pineal gland at night. In the brain, there are receptors for it, melatonin 1 and melatonin 2, which are found in the membranes of the neurons in the suprachiasmatic nucleus of the hypothalamus. This is the center for maintaining biorhythms and hormonal cyclicity. Therefore, melatonin plays a role in contraception, protection of the oxidant injuries, prevention of aging, and treatment of depression, HIV infection, variety of cancers. Commercially, it is promoted as sleep aid and as jet lag medicine by food or nutraceutical industry. In jet lag, which is because of disturbed time zones and disturbed sleep cycles, the circadian internal time is regulated by light as the most potent clue, which is called as Zitbiger. Jet lag occurs in frequent air travelers and cabin crews. It is characterized by daytime drowsiness, insomnia, awakenings, disturbed GIT function. Melatonin use is associated with subjective reduction in daytime fatigue, improved mood, and a quicker recovery to achieve a normal sleep pattern in the target country. Melatonin appears more effective for eastbound travel rather than westbound travels. Traveling across 5 or more time zones, jet-lag symptoms are reduced when taking melatonin close to the target bedtime, say for India 10 p.m. to midtime at new destination. In oral doses of 0.5 to 5 milligram, usually 3 milligram tablet is available, and then continuing it for 3 nights so that to achieve the newer uh, as a sleep aid, it improves sleep duration and quality. When administered to volunteers, it increases REM sleep. It achieves quicker onset, good duration of sleep. There is little morning hangover, and the usual dose is to take 3 milligram to 5 milligram 15 to 30 minutes before bedtime. It is available as prescription drug and OTC and otherwise as on-demand drug. It has also been tried in pre-operative anxiety as a pre-medication to allay anxiety and fear and is given about an hour before the. For male reproduction, melatonin receptors are found in sperms, so it has been found to increase sperm motility in vitro. Female reproduction, melatonin receptors are found in ovarian granulosa cell membranes, and therefore it has a role to prevent oxygen damage and multiple abortions as an adjunct to infertility also. Melatonin requirement increases with pregnancy and may have a role in prevention of preeclampsia and eclampsia. Melatonin is required for fetal neurological development physiologically, and there are no teratogenic effects known when melatonin is used. As such, ADRs are mild, drowsiness on the next morning, fatigue, dizziness, headache, irritability, labile blood pressure, and dysphoric symptoms may occur in elderly. There are many drug interactions is metabolized by cytochrome A1, A2, and which may be induced or inhibited. Inhibited by fluoxamine, which is a potent inhibitor and is induced by smoking and primaquine. Therefore, serious adverse drug reactions can occur when such concurrent administration is done. Melatonin decreases prothrombin time and may decrease the effect of warfarin therapy. And melatonin may also interact with nifedipine, interfering with its antihypertensive action. So in conclusion, many food supplements and nutraceuticals are available in the market and have been used because of assumed efficacy that they can compensate for additional dietary requirements and have medicinal values, albeit there is little evidence available for their established efficacy. Much of their protective risks are perhaps due to antioxidant action and prevention of wear tear induced by changes in the body as age advances. If one is already taking prescription drugs and also opts for additional benefits from nutraceuticals by self-medication, there is a potential for adverse drug effects and adverse drug interactions with the concurrently used medicine. Therefore, it is advisable to discuss with the family physician about their use for long time, and that way we can accrue maximum benefit with the minimum loss. Thank you very much.